Hello, yeah, my name's Chris Beeley. I'm a data scientist. I'm that guy that hassles you in the breaks when you're trying to drink a coffee. This is a horrible graveyard slot. It's pretty well attended considering, but it's my horrible graveyard slot. I helped prepare the program with a lot of help from University of Birmingham. So this is a completely self-inflicted injury. But thanks to everyone that's here. That's really good to see. I've got to tell this story, and it's only quick. Tom Jemmett in my team had a brilliant quote in his talk about a hospital is where you can find people having the best day of their life and the worst day of their life. And I'm very, very, very close to the place where I've had the worst day of my life 3 times, which is the QE. I've had lots of horrible, scary moments there. I've got a sort of vaguely data-related story to tell about that. So I was being assessed for my second liver transplant, and I brought my mum with me. You have to bring someone, a carer, with you because they want to check that someone will look after you after the surgery. So they insist that you bring someone. So my wife was busy, so I took my mum. And I went in to see the surgeon, and they really, they want you to understand the risk. They consent you very thoroughly, and I think that's obviously really important. So I'm sitting there with my mum, talking to the surgeon, and just pretty much out of the blue, really, just says, oh, you've got a roughly 1 in 6 chance of dying. Which was completely not in my range of expectations at all. So I'm sitting there next to my mum, and my first thought was, wow, I wish my mum wasn't in the room because I wouldn't have told her this. And then it finished, and we went and sat outside, and you see loads of people, and we both sat there for 90 minutes, just completely shell-shocked, just like, what a thing to suddenly hear. And then we went to see the next guy, which was my consultant hepatologist, and he said, oh, no, you're fine, no, it's not nearly that bad, you'll be right. And I think there's 2 data elements to that, really. The first one is, like, what is the correct answer? I assumed that my consultant, the second guy, was correct, saying, oh, no, you're fine, kind of thing. But who knows, maybe it really was 1 in 6, I've really got no idea. But I did obviously live to tell the tale, which I'm very glad to say. And I think there's another bit to do with my sort of something I've worked a lot on over the years as an analyst, is to do with patient experience. If you do need to communicate to someone that there's a 1 in 6 chance of them dying, there's probably a better way of doing it than that, I think. And yeah, so they could have tapped me on the shoulder and said, I'm going to say something really dramatic and shocking, so maybe just have your mum sit outside for this bit. So anyway, I couldn't resist telling that story, and if any of my friends ever watch this, which I'm sure they will not, they will all laugh because I go on about my surgery constantly because I like to complain about it. Anyway, so I'm going to continue on the theme of Chris Beeley, I'm afraid, but we're getting to analytics soon. So why am I here? Why this conference is so enormous. I can't believe the amount of work and the amount of people. It's phenomenal. Why am I standing at the front of it, having done all this work on it? So the NHS is in my blood in a literal sense. My dad was a dentist. My brother's a nurse. My mum was a social worker. She worked in a hospital. I've never wanted to do anything else other than work in health. But I didn't go to university dreaming of being a healthcare analyst. I was going to be a psychologist. Who does go to university dreaming of being a healthcare analyst? I bet almost none of you did. Oh, look, there's a person. Excellent. I think they do more now, and that's really awesome. But I can't imagine back in the day, I can't imagine doing that. And I've just, I didn't really mean to arrive here. And I've always been worried throughout my entire career about, what am I doing? Am I helping? I was going to be a psychologist to make people feel better, and I'm doing this. And I've always been tortured by this idea that, am I making a difference? And I've become more and more convinced, I think, over the years that I am making a difference. Partly because of things like this, partly because I can see how much excellent work is going on and hear about all the results of it. And I think, that's put my mind at ease, really, that we're doing something really important. Okay, so, again, back in the day, so I worked in fairly severe isolation. I did my PhD, I finished in 2008, and discovered this thing called R. And thought it was really cool. And then I worked in miserable, horrible isolation for 10 years. Didn't know anybody that did R, didn't know anyone that did stats, really. Just used to sit in a box on my own, and people were nice to me. They would have a cup of tea with me, but none of them knew about what I was doing. They couldn't help me, nothing. And that's really stayed with me, that. And I've made it my job. And literally I've made it my job. I've seeked out job. Seeked out, is that the word? I've sought jobs that allow me to prevent other people from having that experience. And that's kind of that's why I'm at the front of this room now. That's what I want. I want people to have people around them who are doing amazing work, who can help them, and to foster a community of people who are helpful. Because it's not just about seeing the stuff, is it? It's about being able to chat to them afterwards, and it's all that kind of thing that we're doing here. And I've also made it my job to advocate for analytics. So careers and professionalization, development, CPD, all this kind of thing are all really important. So this is kind of my pitch to you, really. So this is a bit of a change to a quote that I love that was published in Nature some time ago. And the original quote is, "We're all smart, distinguish yourself by being kind," which I absolutely love. It was written about scientists, and obviously I'm sure we've all had run into scientists who are very smart and not very kind. And it's just this idea that I've observed many times. I've been in lots and lots and lots of rooms with lots and lots of really, really smart people. And I think that smartness is often wasted because they are spending their time protecting their code, protecting their data, protecting their status, making sure that they're the person who leaves the room with the most power. And I think that really helps them, and I think it really penalizes the system that they work in. So I've changed it slightly because I think, being kind is obviously really important, but to put more analytic spin on it, distinguish yourself by sharing your work. Distinguish yourself by being open, by helping people, by talking about your work, by sharing it, and all this kind of thing. That's kind of my pitch, and that's why I wanted to be involved in this conference, and that's why I want to do the things that I do. So analytics in healthcare is awesome. You all knew that already, but we've just spent 2 days proving it to anybody that was doubtful. And there are 1,000 people on the Zoom license now. We've got, yesterday morning, we were running around and getting more and more Zoom licenses. Now we're up to 1,000 people. Some of them probably got bored and had a cup of tea, I would think, in the middle of this bit, but still, they were up for it. We've punched under our weight for way too long, I think. If you look at the stuff that we're doing and compare it to other people doing brilliant things in health and care, I think it's about time that we took, and this is something that Ben Goldacre said, almost that we have to take our place, really. And I think that this conference, I hope, will help us do that. I think a big factor in helping us to do what we're doing is to curate and share what already exists. So Richard Riley says this when he said, stop making new risk measurements just so you can publish a paper, validate what's already there. Peter said it. Peter said, borrow with pride. Ben obviously talked about it. It's been a theme throughout, and it's one that's always resonated with me. And just, again, if there's any eccentric billionaires listening, if anybody wants to pay me to sit in a chair and curate all the code written in the NHS until it's all done, I will do that. I've fantasized about this job many times. It would be so much fun because you would spend a lot of time sitting in front of the computer reading really cool code, which is really fun. But then you spend the rest of the time trying to find other people that you hadn't heard of yet that were also writing. So that would be the other thing that you did, and you just bounce between those two things. And I could happily do that for however much longer I've got. So my DMs are open, as they say. So yeah, that's my spin. We've heard several spins on Hacker, hasn't he? That's my spin, is that Hacker is all about coming and showing off how smart you are. Yes, absolutely show off how smart you are and boast about how good analytics is, but also do the things that I've talked about, cultivate the connections, help each other, share, be kind, and borrow with pride. So, just go home, carry on being awesome. You don't need my permission to go home, do you? But you've got it. Carry on being awesome. Do all those things that I've talked about. This is a fight. It's been a fight with me for a long time, and there wasn't anybody that was on my team on the fight, but now I find loads of people who are all in the fight, and you're all in the fight. We're going to fight to get analytics the respect it deserves. I think we've got the raw materials, we've got the ammunition. We just need to just point it at the appropriate people and press the trigger. So do that. I'm going to plug NHSR and NHS PICOM because I can. NHSR conference, we need to reflect the breadth of it now. So it's going to, I think, NHSR, NHS PICOM, NHS Open Analytics. I don't know quite how to put all those into one concept, but R and Python will be there. People said that NHSR would die. They said to me that the NHSR conference would die because of Hacker. And I was really positive about Hacker. I said, no, Hacker is something else. Hacker is a different group of people doing different things and talking about different things. And we've had a record number of abstracts at NHSR. And if that isn't an absolute testament to the power of healthcare analytics, that you can have this enormous thing sucking up so much oxygen, and the people down the road are doing better than they ever have. I think, if anything, they actually strengthen each other. And I hope that some of the papers that here, you come to NHSR, NHS PICOM, NHS Open Analytics, name pending, and tell us how you did it. Like, show us, like, get really nerdy, because we like that. You can really dig into the detail. Yeah, and come back next year and tell us what you've been up to. So, I've nearly finished. Very on time. So I want to thank everybody I want to thank everybody who did all the amazing presentations. I haven't seen as many presentations as I wanted to because I have been skipping around doing stuff, but I have caught bits, and some of the bits that I've caught were amazing. I'll be talking about that some other time. So thanks to all the talks, thanks to all the posters. There's obviously, as you all know, there's so much work that I have to talk here at 4:45 where you're going, wow, I wish you'd shut up because my train's at 5:10. And thanks to everybody that came. And as I say, there's loads of people online, so that's awesome. And there's loads of people here. There's loads of people at the bitter end even, so that's really awesome. Thanks to the CSUs and the Health Foundation for making this possible in a very literal sense, for providing the funding. Thanks to NHS England for all of their support. That's really, really important that we're engaged with them. The University of Birmingham events team have been absolutely amazing. Like, I do not know how to make a conference. It's possible some of the hacker team do. I think Matche knows quite a bit, actually, but I have got no idea, and yet it's amazing. So that's really awesome. I am going to mention Matche in particular. Actually, I'm not going to name the whole hacker team. I'm going to mention Matche in particular because he has worked absolutely tirelessly for weeks and months, and we all owe him a debt of gratitude because you would not be sitting here if it wasn't for Matche. So, in fact, round of applause, please, for Matche. And I think, is that, oh yes. And also, there's something I forgot to put on the slide. Do fill out your survey. I've made lots of mistakes along the way. It was not perfect, but it was pretty awesome. So tell us how we can make it better. Go and be awesome. Come back next year, fill in your survey, and we'll see you next year.
Hello. So, Chris, we're going to embarrass you. This is the world's first hacker mug. And you are the world's first recipient of it.
Yeah, I don't know what it looks like even. Do you?
Well, I was told it was.
See the design?
So you deserve it.
Thank you.
That was a terrific way to close the event. Thank you for those of you who stayed. It really matters that you did. That's not to criticise colleagues who had to go. I was talking to people from Cornwall and also there's people who've really had to go to get home. But thank you for staying. You've done an amazing job. I'm really lucky. I'm not an analyst. But I've had the privilege through my career to work with a whole group of fantastic analysts. And the fact that Chris has recently joined us just adds to the pride I feel in the work of the strategy unit. Come next time, come to Hacker 24. It's going to be bigger, better, even better. But critically, it depends on you being there. And critically depends on you, please, giving us your feedback about how we can make it better. But also telling people about it. Tell your organisations. Send an email to your boss. Send an email to the chief executive of your ICS saying, this really made a difference. This matters. We need your support that we can participate in this. There were colleagues in the country who were not allowed to take 2 days off to come to this. We've got to build a sense that this is a critical part of what it is to be a professional analyst in the NHS, that you participate in these types of things. So anyway, thank you very much, everybody, and thank you for helping us make Hacker 23 the beginning of an epoch. Okay, thanks.